Hello, I'm Christy Clement, Oakland County's Chief of Public Health Special Programs. Today, I am joined by two of our epidemiologists, Lauren Fink and Mike Swain. They're going to answer some questions that we are frequently asked about schools, childcare centers, and COVID-19. First, Lauren, can you give us a brief explanation of what an epidemiologist does?
Sure. We are disease detectives. We examine how diseases spread and how we can prevent them from spreading. Epidemiologists can also apply our detective tools to other public health issues like environmental health exposures, as well as social issues like violence.
And what is your specific role working with schools and childcare centers?
The health department works collaboratively with schools to mitigate risk and reduce the spread of diseases like COVID-19. This includes schools reporting cases and close contacts to us, Oakland County Health Division staff assessing cases and ensuring all information is correct, and providing schools with expertise on testing and mitigation strategies such as quarantining, distancing, masking, and vaccination. Oakland County Health Division staff also conducts contact tracing for contacts at schools, in the home, and in the community, and we also identify outbreaks.
Lauren, many parents are nervous about sending young children to childcare and school right now. How can schools and childcare centers make these settings safer?
I'm a parent of an almost 4-year-old, so I know how overwhelming it can be. We recommend that parents look for a childcare center that has strong guidelines around masking and staying home when sick, as well as a high vaccination rate among staff. Best practices are similar for schools and childcare. Schools and childcare centers should practice layered mitigation measures, also known as the Swiss cheese model. No measure is going to be perfect, but if you stack them up like slices of Swiss cheese, most of the holes will eventually be covered. Masking is one of the most effective tools. At this point in the pandemic, I would say it's essential. Vaccination is the other key tool in our toolbox for those aged 12 and older. There's good evidence to show that vaccination protects those around us, including those who are too young to be vaccinated yet. Ventilation is sometimes overlooked, but it's another important part of the layered approach. COVID spreads through droplets in the air, so if the air is exchanged frequently, the transmission risk decreases. Keeping windows open is one of the best ways to do this. I'd encourage parents to talk to your school or childcare about what they are doing to improve ventilation. And of course, being outdoors is great for preventing COVID transmission and has other benefits for children as well. Finally, we need to stay home and get tested for COVID-19 when we're sick. If you're not sure, it's best to stay home or keep your sick children home just in case. Schools and childcare need to support their students and staff. Students might worry about getting behind in class, and staff may worry about being penalized for staying home. The more we can do to relieve those fears, the more likely it is that people will choose to stay home when they have the sniffles or a mild cough.
Thanks, Lauren. All good things to look for. One common question that we get asked is if there have been any COVID-19 outbreaks in Oakland County childcare centers and schools.
Yes, there have. As few as 2 or 3 cases of COVID-19 in a particular group of people could be considered an outbreak. With a virus as contagious as COVID-19, there are going to be outbreaks anywhere people gather. Outbreaks seem to be more common in childcare settings than in K-12 schools, as the small children are less able to adhere to distancing and mask wearing. While there have been a couple of large outbreaks of 10 or more cases, most cases in childcare centers and schools don't result in any transmission at all. We've noticed some patterns and risk factors. Often, an outbreak is started when someone continues to work or attend school while symptomatic. Centers and schools that do not enforce masking and classrooms where the children are too young to wear masks may also be at higher risk. Parents should keep in mind that just because there's a COVID-19 case in a childcare center or school, it doesn't mean that the facility did anything wrong. They can't really prevent someone from getting COVID outside the center or school, but if they have strong protocols in place, they should be able to prevent or limit spread inside the facility.
Definitely. Mike, we know that the mortality rate for COVID-19 among children is lower than that of adults. Can you explain why it is still important for schools to implement mitigation measures?
Sure. First and foremost, one pediatric death is one too many. Public health has always been concerned about rare health outcomes among children. Children who have COVID-19 are also at risk of a very serious condition called multisystem inflammatory syndrome. And many children experience long COVID, which can impact their quality of life for months. In addition, every case, regardless of age, presents a risk to everyone that person is around. In Oakland County, those 19 and younger have the second highest number of cases at over 20,000 cases among all age groups since the pandemic began. 10 to 19-year-olds currently have the largest case rates among all age groups in Michigan. And the 0 to 9-year-old age group saw the largest weekly increase in cases last week. We know that the Delta variant is much more contagious than what we were dealing with last year. Whereas each person infected with the original strain would, on average, infect 1 to 2 other people, those infected with the Delta variant infect on average 4 to 5 other people. This is why mitigation measures are so important. If we can use masks, vaccinations, distancing, testing, and contact tracing to prevent more cases, we can prevent illness and death among all age groups. Local health departments have been concerned about the spread of infectious and vaccine preventable diseases in schools for years, because schools are large communal settings.
Thanks, Lauren and Mike, for joining me today. As always, please continue to wash your hands frequently, stay home when sick, and wear a mask in crowded settings to help prevent COVID-19. One by one, as our residents get vaccinated, we are closer to ending this pandemic. Thanks for listening and have a great week.